Today we will be talking about the probe. It is a double-ended instrument that is unpaired. It is circular in cross-section and it's the Marquise probe. So it has 3mm markings and it goes up to 12. I also have the cotton tip pliers and the mirror with me today. The neighbor's probe is also another option that you can use to measure furcations. The Marquise or color-coded probe is used for a variety of different uses in the mouth. Like I said before, it's in millimeter markings. It is used to assess the health of the periodontium. It measures the cal, the recession, the width of attachment, the size of lesions, intra and extraoral, bleeding areas, and to determine mucogingival relationships, and to monitor the longitudinal response of the periodontium to the treatment. It also has a blunt tip at the end of it. And whenever I work on a patient, I will have proper PPE on, which includes glasses, mask, gloves, appropriate uniform. And I'm also going to ask the patient about their history of the periodontium. So if they've had scaling and root planing before, or any gum disease in the past. So now I'm going to do my frenal involvement. So I'm going to check how well it's attached. Looks good. And then now I'm going to talk about my order that I will go in. I will start at tooth number 1 and go to 16 on facial, and then go from 16 to 1 lingual, and then on the bottom I'll go from 32 facial to 17, and then 17 to 32. Alrighty. Now I'm going to do my width of attachment. So I'm going to check from the gingival, hold on one second. Check from the gingival margin all the way down to the mucogingival attachment. So that's about 6. And then my pocket depth is about 5. So 6 minus 5 is 1, so your width of attachment is going to be 1. And your bleeding on probing, you're going to measure also with your probe. And I would do my facial first, and then I would go to my lingual, and then check my facial again after I'm done with the lingual to see if there is any bleeding on probing. Alright, so now we're going to check for recession. So on tooth number 3, there's about 3 millimeters of recession there. Tooth number 6 looks okay. tooth number 20 also looks good. We're going to now check for locations. So we're going to go to tooth number 14. And it's about a type 2 furcation, because when I go in, I can feel it. That lets me go inside.